Hello, so this is Mensah, and today's class is about adenomyosis and endometriosis. Alright, adenomyosis, adenomyosis, and endometriosis, endometriosis. Well, the very reason why I'm doing this particular video or having this particular class is because we ourselves, as health practitioners or health professionals, often use the terms interchangeably. Alright, we interchange the terms. Instead of saying adenomyosis, we say endometriosis. Alright, and vice versa. And that is the much more reason why I'm doing this particular video. Alright, aside this video being a beneficial video that I know, if you listen and watch to this particular video, it's gonna benefit you a lot, whether or not you're a medical practitioner. Right, so let's dive real quick into it. Now, adenomyosis. When we say adenomyosis is specifically or basically the presence of endometrial tissues in the myometrium of the uterus. Alright, the presence of endometrial tissues in the myometrium of the uterus. Now, what is the pathology here, or what is the abnormality here? You see, endometrial tissues are supposed to be in the endometrium physiologically. Endometrial tissues are supposed to be in the endometrium. So in the instance where endometrial tissues are found in the myometrium of the uterus, then it brings about the idea of what? Tissue ectopy or tissue displacement. Alright, now this is the pathology. The tissues are displaced, they are dislocated, they are no more at where they were supposed to be. Alright, good. So that is adenomyosis. Now, on an abdominal or abdominopelvic palpation, so with regards to examination on abdominopelvic palpation might reveal, tender globular pelvic masses. Right, so on examination it might be a review of what? Tender globular pelvic masses. Now, adenomyosis is confirmed clinically and is diagnosed clinically and confirmed with what? A pelvic ultrasound scan. Alright, so to diagnose adenomyosis you need a pelvic ultrasound scan, and it could be managed medically or surgically. Alright, adenomyosis can be managed both medically and surgically. Alright, now that is that for adenomyosis. Let's look at endometriosis. Now, so you see, endometriosis is actually a tissue in a condition in which, now, endometriosis is actually a condition in which endometrial tissues or tissues similar to that of the endometrium are found or seen outside the uterus. Alright, condition in which tissues similar to that of the endometrium are found inside or seen outside the uterus. For example, on the surface of the ovaries, in the fallopian tube, in the peritoneum, even at the umbilical region or the umbilicus. Alright, so that is endometriosis. So you see that with adenomyosis, it is occurring in the uterus, between the endometrium and the myometrium. Alright, the innermost layer and the middle layer of the uterus. But with endometriosis, it is occurring outside the uterus. Alright, it is occurring outside the uterus. Now, there are no known causes of what? Endometriosis. There are no known causes of endometriosis. However, there are theories. Alright, there are theories that explains the pathophysiology of endometriosis, or there are stories that tells how endometriosis can possibly come about. Alright, so basically I'm going to talk about two theories. So one, we are going to look at the implantation theory, and then two, we are going to look at the coulombic metaplasia theory. So now, the implantation theory. The implantation theory basically is of this idea. You see, physiologically, when ovulation occurs and there is a release of the matured follicle or ovum in the fallopian tube, there is supposed to be copulation, so that there will be the release of a sperm or a spermatozoa to fertilize, the ovum or the egg for, production of a zygote. The zygote matures, moves into the uterine cavity for implantation, all right, and further maturity. In instances whereby all these doesn't happen, all these activities that do not happen after ovulation, the egg and the uterine cavity, uterine lining of the endometrium shuts away in a form of menstruation, all right. So the retrograde passage of this menstruation reaches the peritoneum and then proliferates and undergoes further hormonal changes, resulting in the production of endometrial tissues in the peritoneum. You get it? The retrograde passage of menstruation reaches the peritoneum, it proliferates and then undergo further hormonal changes, resulting in the production and maturation of endometrial tissues in the peritoneum instead of being in the endometrium. That is what? Displacement of tissue or tissue ectopy. And that brings about the idea of what? Endometriosis. So that is for the implantation theory. Now let's look at the coulombic metaplasia theory. Now, so the normal coulombic cells are known to give rise to what? Epithelial cells that forms the epithelial lining of what? Body cavities. All right. So in instances whereby these coulombic cells, instead of giving rise to the epithelial tissues or cells, undergoes metaplasia and then produces endometrial tissues, it is said to be what? Endometriosis, because it is not going to happen in the uterine cavity. It is going to happen outside the uterus, in any body cavity possible. All right. So that is the idea of what? The coulombic metaplasia theory. So usually patients might present with dysmenorrhea, dyspareunia, lower abdominal and lower back pain. All right, lower abdominal and lower back pain. So dysmenorrhea, dyspareunia, lower back and lower abdominal pain. So that is that. Patients might present with that. Okay. Now, how do we diagnose endometriosis? So endometriosis is diagnosed clinically and then confirmed with a laparoscopy or laparotomy. All right, laparoscopy or laparotomy. This is basically done by obtaining uterine tissues in the form of biopsy for the purposes of what? Histopathology. All right, so you obtain uterine tissues for histopathological studies or purposes. So that is that. Now, endometriosis could as well be managed what? Medically and surgically. However, the treatment of endometriosis is tailored alongside with the patient's needs. All right, treatment of endometriosis is tailored alongside with patient's needs, considering the patient's age, the patient's reproductive wishes, as well as the intensity or the severity of the disease or condition. All right, so we look at the patient's age, patient's reproductive wishes, and then the severity of the condition to treat endometriosis. And like I said, it could be treated medically or what? Surgically. So medically, you could actually treat endometriosis by using combined oral contraceptives, right? Combined oral contraceptive pills. Okay, and then you could also manage it surgically by the removal of the endometriotic tissues, or better still, hysterectomy with oophorectomy. All right, that is in instances where it involves the ovaries. But as to if you remove the uterus, the ovaries are useless. You can't survive because they are attached to the uterus. All right, so hysterectomy with oophorectomy. That is how we are going to manage endometriosis. So that is that on adenomyosis and endometriosis. Adenomyosis and endometriosis. So I hope you had a better class today. You understand whatever that was taught here or said here. Now, If you haven't commented, you should do that. Tell us how you felt or what you've learned a bit in the comment section. Like the video, share to a friend to have the insight you've had. Alright, and if you've not subscribed already, you should click the subscription button. Alright, subscribe so that you get more knowledge from this knowledge hub. Bye bye.